Tim Kaine didn't come to play. He came with proof. In this hearing, he exposes the real-world fallout of RFK Jr.'s decision to slash 20,000 jobs from Health and Human Services. Kaine connects the dots between bureaucratic cuts and human consequences. Veterans losing work, seniors stranded without Medicare answers, and cancer patients left waiting. This wasn't just oversight, it was accountability with receipts.
Thank you, Mr. Kennedy. I want to ask you some questions about staff reduction and kind of the timing of it. You were confirmed by the Senate on February 13, so I'm sort of assuming that things happened before you were confirmed were other people's work. On January 28, the fork in the road letter came out to people across the federal employment space, widely attributed to OPM and Elon Musk and Doge. But that was before you were confirmed, so you had nothing to do with the fork in the road letter, correct?
Correct.
Okay. You were confirmed on February 13. On February 14, one day later, HHS announced that 3,500 probationary employees were going to be laid off. I know you're a hard worker, but am I right to assume that in the one day between your confirmation and the next day, you weren't the primary decision maker about laying off probationary employees at HHS?
I was aware of it, and I could have blocked it.
Yeah, you were aware of it, so you weren't the primary decision maker. Was that a decision that was made like OPM or Doge? And because it wasn't just HHS, it was all federal agencies would lay off probationary. Do you know where that decision was?
I had my full upper staff in place before I got there.
Right, but did they make the decision, or was it White House and Doge to lay off probationary employees?
They made the decision. My staff made the decision,
Okay.
although Doge came in, and Doge gave us information that we wouldn't otherwise have had access.
Okay. Next, we go to April 1st.
I can also say this.
No, all I asked was if you made it, and you answered the question, and I appreciate it. April 1, HHS RIFs 10,000 employees effective June 2. Now, by this point, you had been secretary for about 6 weeks. A few days after that announcement, HHS staff briefed our staff, the Senate help staff, and basically, just here's some highlights. In that 10,000 RIFs, 467 staff at the Administration for Children and Families, 2,473 at the Centers for Disease Control, 322 at CMS, 400 at HRSA, 1,312 at National Institutes of Health, 197 at SAMHSA, 2,519 at the Food and Drug Administration. By now, you've been secretary for 6 weeks, so this was RIFs, not the forks, but you were involved in the decision about these 10,000 RIFs, correct?
Yes.
And in tandem with your leadership team, correct?
Yes. Yes. And as I said before, I pushed back on certain ones and canceled certain ones.
Yeah. I think yesterday, it may have been earlier today, you confirmed that 20,000 employees have been let go, 10,000 at HHS, 10,000 RIFed and 10,000 forked. Do you know how many of the 20,000 were veterans?
No, I do not.
That is a fact that's very easy to determine from someone's personnel file. So I'm going to ask that question for the record. We are finding across the government that veterans are disproportionately being let go, A, because they're a higher percentage of the federal workforce, and B, they're a dramatically higher percentage of probationary employees because they leave military service after 10 or 25 years, and then they're probationary new employees when they join the civilian service. So I want to find the answer to that question. Where does the rubber meet the road on 20,000 RIFs and layoffs and forks? In people not getting cancer trials, and I appreciate your willingness to help Senator Murray's constituent, in state grants being canceled, in Virginia losing $425 million in funding to the Virginia Department of Health. But here's a small example. All of our offices do casework. All of them do casework. And we get requests from constituents all the time. CMS is the largest agency in the federal government. Its budget is nearly twice the size of the Pentagon. And people who depend on Medicaid, Medicare, and the SCHIP program really, really depend on it. And it's the most consistent in the top 3 or 4 in terms of constituent requests to my office. Answer this question about Medicare or Medicaid or the SCHIP program. In every administration I've served with, Obama, Trump 1, Biden, I get answers to questions on behalf of constituents. I may not get them as fast as I like, and sometimes I like the answer and sometimes I don't. But let me show you what CMS is now doing to answer constituent questions. I've omitted the name of the constituent, and I've omitted the name of my staffer. This was very recent. A hardworking retiree, patriotic tax-paying American who's on Medicare wrote to ask CMS a very simple question about Medicare. Couldn't get an answer. Asked us to reach out. We reached out to the Medicare Part C and D Congressional Liaison Office. And here was their answer to our basic question. Unfortunately, there is not an update to provide. With the recent change of administration, we are unable to provide any information related on matters related to Mr. X's request, Congressional Casework Team. I mean, if you're just an everyday, hardworking American retiree on Medicare, and you have a basic question about it, you ought to be able to get an answer. And I'm just going to say, I've shared this with my colleagues, and many of us are having the same experience where our constituents can't get a basic question answered. I wonder if 20,000 fewer employees is connected to this. I yield back, Mr. Chair.
What Senator Tim Kaine did in this exchange is something we rarely see in Washington. He connected bureaucratic decisions to human lives. He didn't just argue numbers. He drew a straight line from the 20,000 layoffs ordered under RFK Jr.'s Department of Health and Human Services to the struggles of everyday Americans. Think about that for a moment. 20,000 federal employees gone, just like that. Many of them veterans who had already served their country once, now pushed out of civilian service. And it's not just about job loss, it's about what that loss represents. Fewer hands to process claims, fewer experts to oversee life-saving programs, and fewer people to answer the phone when an elderly patient calls about their Medicare coverage. Kaine lays out the pattern clearly. From the fork-in-the-road letter to mass reductions in force, these cuts weren't isolated moves. They were part of a coordinated effort to streamline government, but at what cost? The cost is that people with cancer can't access clinical trials. The cost is that a retiree, after decades of paying taxes, can't even get a basic answer about their benefits because the staff who would have handled it were laid off. RFK Jr. insists that the department is simply being efficient and accountable. But efficiency is meaningless when the system stops functioning. When your parents' medication approval gets delayed, when your disabled child's Medicaid appeal vanishes in bureaucratic limbo. This is what happens when anti-government ideology runs into real life. People get hurt. And Kaine's example hits especially hard. A single constituent, a retiree, asked a simple question about Medicare. Instead of help, they got an automated brush-off. We are unable to provide any information with the recent change of administration. That one line captures the entire failure. It's not just the system breaking down, it's people being abandoned by the very government they depend on. The truth is, government isn't just an abstract entity, it's people serving people. Nurses, data analysts, policy experts, social workers, all working to keep America's social safety net from collapsing. When we treat them as expendable, the safety net unravels, thread by thread. And that's what Tim Kaine was really saying here, that these cuts aren't about efficiency, they're about eroding trust, shrinking government until it can't do what it was built to do, protect, serve, and sustain the people. So the next time you hear about reducing bureaucracy or cutting the federal workforce, remember this moment. Behind every number, behind every efficiency, there's a name, a family, and a consequence. If you believe government should work for the people, not against them, don't forget to like this video, share it, and subscribe to Left Lens, where we break through the noise and expose the real stakes behind the headlines.